30. Okay.
11:28 on mine.
11. So, good morning. My name is Senator Kathy Sheran. I chair the Health and Human Services and Housing Committee in the Senate. And as a way of explaining in context who I am beyond that, I want you all to know that before I came to the Minnesota Senate, I was teaching nursing at Minnesota State University, and that my background is in the area of mental health and chemical dependency. And not only have I been involved in treatment programs for the chemically dependent, but as an advanced practice nurse with prescriptive authority, I've worked in outpatient clinics with many persons with various forms of mental health issues, their families, and their children. So I come to the Senate already very aware of the unique concerns and needs of families that are dealing and struggling with mental illness, and care very much about the state providing the kinds of supports that are necessary for us to be effective in dealing with mental illness. And I also care about them because oftentimes, unlike other very large lobbying groups, the groups that support the initiatives for the mentally ill, especially the persistently mentally ill, who because of that illness aren't able to stay employed or able to retain resources in order to have a living situation, aren't able to come here and advocate for themselves and for the services and supports that they need. So they do need those of us who are here to be strong voices for them, even though we don't have the numbers and the resources in order to make our position clear in the legislature. So today we are coming together because of the recent violence that we've all been confronted with in our communities. So when I listen to the conversations that have occurred in our communities in reaction to that violence in our state, in Newtown, I hear people really wanting to reduce the prevalence of violence. There are multiple causes for violent action, especially when associated with guns. Some causes are related to criminal behavior and to gangs, and rooted in the need for control, and rooted in the need for power, rooted in the need for resources in order to buy drugs for an addiction. There are multiple causes for violent behavior. There's also social and cultural, environmental factors that contribute to violence. We have a culture that enjoys violence through voyeurism, participating as an observer, while not accepting any responsibility for how being a customer of violence is contributing to its perpetration. Sometimes the root cause of violence can be contributed, sometimes, to unrecognized or undertreated mental illness. The initiatives that I am introducing, along with others who are here, by this legislation are related to untreated mental illness, or the need for early recognition and intervention in serious symptoms of mental illness when they emerge. The initiatives deal with the lack of support for the mentally ill, for their families, in dealing with children who first have breakthrough symptoms that can lead to much more serious problems in later life. I think it's important to say that our failure to target our initiatives, whether it's these or others that will be presented in the legislature, our failure to target those initiatives towards the factors that lead to and contribute to violence, make us complicit in the tragedies. We are complicit in the tragedies that have affected our communities. And that's the central underlying belief system that I have, that it is irresponsible and creates complicity if we do not act in the legislature in multiple ways. And we therefore are participating in the outcome of this, which is family members losing family members and creating fear in our parents and children for their own safety. So these initiatives take steps to prevent the progression of violence, the kind of violence that can lead to, that can occur as a result of a progression of mental illness. So within the context of the bill, one of the major components of the bill is to increase schools' capacities for mental health prevention through early intervention services with a special emphasis on integration of services for the struggling child and family. This proposal expands school-linked mental health services and will provide early intervention and connection to treatment that will help serve more children than have ever been served before, many of whom have never had contact because of the lack of resources with the mental health system. It is in a school-linked grant program that, with early identification of symptoms and early intervention and creation of a coordinated support service for that child and their family, that we will be able to help prevent the progression and deterioration to more severe symptoms of mental illness. This is the type of intervention the legislature can make and really impact the escalation of symptoms that to a point where if we do not intervene, the escalation of those symptoms get to a point where the victim of psychosis or victims of a paranoid personality disorder or a person with initial experiences with the psychosis associated with mania become aggressive in response to the confused integration and interpretation of what is happening around them. That's what psychosis is. And what we need to do is to identify its early recognition of the symptoms and assist the families to integrate into mental health support systems. And the school-linked program is one initiative that attempts to do that. This particular aspect of our bill is included, not at the same level that we would like, but it is included in the governor's budget. And under his budget, we'll have something like 7,200 students have contact with early mental health initiatives that have never had that before when they needed them. This bill also provides an exception to the drug formulary for patients experiencing their first or second psychotic episode. And what that means is that it will stop a bureaucratic process from occurring that really stops prompt intervention with medication. It interrupts a bureaucratic process that we do not have time to go through in order to really have an impact on the progression or escalation of psychiatric symptoms. The bill states counties will continue to provide case management services. This is a county obligation for children and young adults who are diagnosed with very severe emotional disturbances until the age of 26, if it's requested by the child or the child's family. This is an expansion of the county's responsibility. Continue to hold support systems for families who have told us over and over again that they can see that their children are experiencing mental illness diagnoses. They see the symptoms, but they're not able to find support systems anywhere in order to help them intervene with those symptoms. We've heard that in the discussion of the family whose child recently in the state of Minnesota engaged in such horrific behavior in St. Louis Park. The bill provides training for health professionals and mental health professionals on early psychosis, and it provides psychoeducation for the individual and the family for the assessment, the recognition, best practices in early intervention that reduce the progressivity of psychotic symptoms. And finally, it funds special projects for the treatment of adolescent and young adults who have had their first episode of psychosis. And I'm certain you all know what I mean by psychosis, but it is an experience in the central nervous system in which the person, because of the interruptions in brain chemistry, have a great deal of confusion about the integration of information, so that it either disallows the person from properly integrating the information or misreading the communication, and it creates very high levels of anxiety. It would if you think about it for yourself. And it is that anxiety, it's the anxiety at psychotic levels that creates the person's fear base and the need to protect themselves. You know, it's a faulty communication system. It creates a faulty reality, but it is real. It's a real experience for the person, out of which the person can act out violently. So those are the essential elements of this particular piece of legislation. There may be more, but the most critical message that I really am wanting to communicate is that I think that we're complicit in violence if we don't intervene in the factors that we know contribute to violence. I want to communicate that I think there are multiple causes for and very different kinds of violence. Some violence related to crime, related to trying to gain power, trying to gain resources. And that's a very different thing than the kind of violence that occurs out of mental illness. But why it's important to talk about, we also have a social environment that has voyeurism in relationship to and experiences pleasure by watching violence. Those contribute to the environment and the culture of violence. And I say that a second time because I'm concerned about, while we want to intervene in the mental illness issues, we don't want to start labeling every mentally ill person as something that people should be afraid of in terms of their progression towards violence. So that concludes my opening remarks. I really want to have an opportunity to introduce to you Senator Claussen. Senator, I'm asking you to come forward. Let me tell you a little bit about you, Senator Claussen. No, we were just hoping that you would make it here. I don't know where I put my notes down. He has an incredible background and experience in the school system. I'm going to read it to you. Senator Claussen was an educator for over 40 years, classroom teacher, coach, assistant principal, principal at Rosemont High School, served on Dakota County Affordable Housing Coalition, vice chair of the board of Dakota Woodlands Homeless Shelter. Great background, and I've asked him if he would come today out of the school perspective to talk a little bit about this bill and why the school-linked initiative is so important and how it can be helpful in reducing violence.
Thank you, Senator. My name is Greg Claussen, and has been identified. I've got a pretty strong background in education. And as I was driving to the Capitol this morning, I couldn't help but remember the students' funerals, memorials that I attended. Unfortunately, some cases because they took their own lives, or through accidents, or perhaps through an illness. And you sometimes wonder how we can change things. How can we make a difference? And I think one of the things, if you would talk to high school counselors, middle school counselors, they say mental health issues, excuse me, mental health issues are really on the rise in our schools. Currently, only about 17% of our schools have mental health professionals in them. At one time, when I was principal at Rosemont High School, we had a grant that was very helpful. So about 4 years in a row, we were able to have mental health professionals work in our building. And it's not only the mental health professionals that you have in your building that are working directly with students, but when you have problems within the family, when you have a death of a parent, when you have a death of a student, that affects everyone within that school community. And being able to have professionals there to deal with those issues, to work with students, to work with families is really critical. Our high school counselors usually have caseloads of over 500 students. Their experience, their background, their role in many cases is for academic counseling. And the expertise, the time to work individually with students is something that we really need to address. And that's why I am supporting the bill that you're hearing about today, and I really believe it can make a difference. So thank you.
Thank you. I failed to mention here, I see that Senator Dibble is here, and he'll be surprised that I'm going to ask him to say something, but so get ready. When I was talking about multiple factors that contribute to violence, you can't just say it's somebody that's mentally ill with a psychotic episode. Because if that's all we reduce it to, we will really be missing the opportunity in this legislature and in this moment when everybody has a heightened sense of concern about the safety that we have in our community, that we'll be missing the point. So it is with some trepidation that I'm talking about mental illness things today, because I don't want to contribute or participate in that. And I was talking about psychosis, which is a neurological issue for how the brain chemistry functions. But bullying is another issue of a concern in the schools. And in terms of the development, psychological and chemical development of the brain, and the problem-solving capacity of adolescents because of their age, the options, what they see, first of all, they can't see into the future. They have not enough background or history to anticipate that things are going to get better. So they're high risk for suicide, and they're high risk for violence because they don't see other options and possibilities for them in the future. So in context of talking about interventions with guns, interventions with early intervention for mental illness, we also have to talk about what we're doing in our society as voyeurs of violence, and also what we are not doing in order to address environmental factors in our schools that create this sense of hopelessness in young people. And to that end, I'd like to ask Senator Dibble to step up.
This is what we call winging it. Thank you very much, Senator Sheran, for bringing this initiative forward. Some of you have recognized Senator Hoffman.
They're all probably going to get 2 cents.
I was a little, and then we have, of course, State Representative Diane Leffler, who's here as well. Just very, very quickly, I don't know if Kathy Sheran touted her own credentials, but she is ideal to help lead this initiative alongside the leadership of Sue Abderholden, of course, with NAMI, because of her professional background, of course, as a civic and community leader, but of course as a mental health professional herself coming out of the field of nursing. You know, this bill has so much to be commended. Its holistic approach, case management services, early identification, knocking down barriers of access to mental health services that we've seen in the schools. I appreciate the connection to the anti-bullying initiatives that we'll be launching here in the legislature that come out of the work of the governor's task force. We just saw the study released a few days ago that talks about the impact of trauma on adolescent child development and the lingering effects it has on into adult life. So it's our goal together to step up as adults to respond to the problems, the issues, the challenges that our young people are facing. And if we don't respond, as they've been asking us to now for a number of years, particularly in this bullying arena, and we've been talking a lot about the fact that young people don't have access to mental health services. We've been talking about that for a long time. We're responsible. We're responsible for the consequences and the impact in the immediate lives of children and their families, and the culture and climate of our schools, as well as what happens over the long haul as kids struggle and strive to move into productive and successful adulthood. So thank you very much. I also appreciate the comments of Greg Claussen, who hails from my alma mater, Apple Valley.
We also have someone very familiar to you, Sue Abderholden, who I'm going to invite up along with Eide, who will speak to you from organizations that represent the group who suffers from mental illness.
Thank you. Good morning. You know, in the wake of the recent tragedies, there's been a lot of discussion about how do we prevent these things from ever happening again. Some people are focused on restricting access to guns, but today we're focusing on how to improve the mental health system, specifically for those who may be most at risk for harming themselves or others. I do want to emphatically state, though, that most people with a mental illness are not violent, even those who have a serious mental illness. No more than 5% of all violent acts are committed by people with a mental illness. They are 11 more times likely to be the victims, and frankly are more likely to hurt themselves. The number of people who die by suicide is nearly twice that of those who die by homicide. For that very, very tiny percentage of people, we know that they are more likely to be young and in the very early stages of developing a psychotic illness, and they are also extremely isolated. This means that in order to help them, we need to work on earlier identification and treatment, and when there is a psychotic episode, we need to intervene with intensity, providing therapy, psychoeducation, family psychoeducation, support groups, and helping them to return to work or to school. The bill being introduced by Senator Sheran and Representative Liebling really takes the important initial steps to get there. And I just want to mention for just a second about the early episode. You know, if you have cancer, they don't say to you, come back when you're stage 4 and we'll help. They intervene right away. When you have a psychotic illness, they say, wait until you've failed numerous times. You've got to be hospitalized or have been in jail, all those kinds of things, before we'll provide you a little bit of service. And so what we need to do is turn that around. And so the moment that someone experiences their first psychotic episode, we really need to be providing the most intensive treatment that we have so the trajectory of their lives is a positive one. Thank you. And I'll turn it over to Ed.
Good morning. My name is Ed Eide. I'm the Executive Director of the Mental Health Association of Minnesota. Since 1939, the Mental Health Association has advocated for services to people with mental illnesses. We've come a long way in those 74 years, but we still mostly have services after the illness may have caused negative outcomes. We need strong local mental health services in our communities that allow people to live well. Just as adults, 1 in 5 young people has a mental illness, but only 2/3 of them are getting the help they need. My mom, my 96-year-old mom, was a school nurse for almost 30 years. And when Senator Claussen was talking about the counselors in schools now compared to, it was a long time ago that I was in school. But my mom, as a school nurse, knew what was going on in the families in the school. And it was a safe place. They could talk to her. They could talk to other people. We've lost some of that, I think, as we have crunched budgets in the state. We know anecdotally that when any illness is diagnosed early, recovery is likely. With many of us, we often don't respond to those early signs of illness, whether it's heart disease, diabetes, or mental illness. We used to expel college students if they were diagnosed with a mental illness, stopping them short of their chosen education. Now, since many of them are on their parents' health insurance plan, they're more likely to receive the treatment for recovery. Early identification and intervention services, whether in schools, colleges, or clinics, are less costly and likely more successful than services in jails or hospitals. These services keep people out of institutions and in their homes. The National Institute for Mental Health estimates that successfully diverting one high-risk child from unfortunate outcomes may result in a net savings to society of nearly $2 million, not to mention improving the life of that child and his or her family. Early detection can help parents and caregivers identify children's and adolescents' emotional or behavioral challenges and assist in getting these youth into appropriate services and supports before their problems worsen and longer-term consequences develop. Thank you.
Thank you. I also would like to offer the opportunity to Senators Hoffman and Eaton if they would like to make some comments. Unlike the House, you remember in the Senate we only have so much space on our bills for people to sign on. And so I appreciate the co-authors that have signed on, but I want you to know that there was a rush to sign on to this bill. There just simply wasn't enough room. But the caucus is very, very interested and supportive in participating and moving forward strong mental health initiatives that can curb the progression of serious and persistent mental illness. So, John and Chris.
Thank you, Senator Sheran. I'm Senator Chris Eaton. I work in mental health and have spent the last 35 years of my life working in mental health, and I strongly support this bill. I currently, when I'm not here at the Senate, work in community mental health, and I am just really hopeful that this is the type of initiative that's coming forward now. I've worked with so many people who would be in such a different place if this would have been available to them when they were younger. Thank you.
Absolutely, thank you. I'm Senator John Hoffman, representing Senate District 36, which is Champlin, Coon Rapids, and Brooklyn Park. And I brought with me, I served 8 years on the Anoka School Board, and Superintendent Denny Carlson is here with me today. And he reminds me that the early intervention is a big key. And when you're talking about the thousands of students in that district, having the early intervention services to provide support is really going to be important, and it's going to be a cost savings in the long run. I'm glad to see those numbers that Ed put out. What's really exciting about this bill is typically county services are going to stop at 18 and they're going to transition to adult services. And school districts, if a child is on an IEP, is going to have to provide those services until the age of 22, as soon as they turn 22. Transition, to have consistent transition and consistent support up until the age of 26 is a huge factor, and I want to applaud us for putting that in there. That's wonderful to see that. Another thing, too, is the parent support piece. We need that support on the ground, but I'm proud to be part of this initiative, and I'm glad that we're going to move forward and try to get things done right for our children and society. Thank you.
Well, thank you, Senators. I think that enough has been said. We're emphasizing the importance of family supports. These interventions are science-based. They're proven to be effective if we simply train and educate people as to what they are, and really turn away from being afraid of people because of the symptoms that they're presenting, and really step forward rather than isolate. So with that, we will open it to, I hope you have some questions if you're unclear for some of the people who are here to answer your questions.
On the school-linked segment of it, are these the professionals that are dealing with the children? Are they trained as nurses, or are they social workers, or some other discipline, or any kind of staff? And are they talking about learning more about how psychotropic meds work, or I mean, how does the schooling part work?
The school-linked grants actually go to the mental health provider, not to the school. And then the mental health provider, of course, has mental health professionals. They can bill private and public insurance, and they can actually provide the clinical treatment that the school support personnel cannot. But we need all of them. So we've got the school support personnel, such as school counselors, social workers, nurses, psychologists, kind of keeping kids from getting really ill. But when they get really ill, then we bring in the school-linked grants, and we have the clinicians who can actually provide that service.
Get those services at the school, or do
right at the school? We've broken down all the barriers. Parents don't have to worry about taking off at work, driving long distances, especially in greater Minnesota, to obtain services. They don't have to worry about a 3 or 4 month wait. It's all right there.
What about the beds? You mentioned that before, the number of beds. Everyone talks about, getting treatment, going somewhere, but we've said in other news conferences, maybe elaborate on what's going on with that.
There's been a lot of people that said, well, what we really need to do is increase the number of hospital beds. People are in hospitals for a very, very short period of time and a very tiny percentage of their lives. If we don't do anything in the community, all we're going to see is people coming in and out of hospital beds. And what we really want to do is keep people stable and healthy in the community.
How will the school thing work on that?
Well, the school thing will work on that because you're intervening early. And you're actually making it easy for a child to complete the treatment. We've had these grants since it was part of the 2007 Mental Health Initiative. We've had them since 2008. We've served over 13,000 children, half of them who never received services before, and half of them who had a serious mental illness. We have a very high completion rate in terms of a treatment plan, and we also have data showing that kids actually got better.
And the term beds refers to inpatient
hospital beds.
And the treatment we're talking about here is mostly outpatient.
Outpatient and in the community where people are.
For the parents, how the advantage of doing it to the schools?
For the parents, an average kind of number of therapy visits is at least 10, and sometimes it's 20 to 25. And so I think I would, ask all of you, how easy would it be for you to take off of work every week, sometimes driving to, an hour to where the therapist is. So you could be as many as 3 hours a week taking off at work to help your child get to treatment. A lot of jobs don't let you do that. And so this really makes it easy for families to have it right there.
Could you say and spell your name for me, please? Could you just say and spell your name for me?
Sue Abderholden, A, B as in boy, D as in dog, ERHOLDEN.
How much does the bill cost?
Well, the bill asks for $10 million for the school-linked program that expands these grants that will be available to mental health providers to establish contracts with schools to provide these services, to link what they're doing, their services, and to go into the schools. They'll have to establish a contract with the school for where they meet and those kinds of things.
Additional to what we're spending now?
Yes, this is the $10 million.
Okay, but the governor has some additional in his
Yes,
budget.
yes, he does. I think his amount is about $7.5 million.
We're just asking for a little more of the same thing.
That's correct.
Okay.
We're asking. This initiative, this idea has been in formation and in conversation for a long time. So when the budget came out, that's the number that it came, but the size of the bill. The rest of it we have yet to place numbers into the bill. But some of the costs of the School Link program can be collected through, because you're using providers, they can collect it through third-party reimbursement if that's available.
Is part of the work with the families here too, helping them acclimate themselves to the reality that they have an ill person or a person with experiencing illness, and kind of get over some of the kind of attitudinal barriers?
All of that is a part of the initial intervention and treatment, is simply recognizing that this sometimes is not an adolescent behavior, that this is it's very hard for a family. Psychosis oftentimes emerges, serious psychosis, in late adolescence, sometimes when they're in college. And it's very, when students have been doing very well in school and then suddenly have a major kind of psychotic episode. And families become very confused. They don't know what they're seeing or what they're looking at. So the answer is yes, that it is about helping families understand that what they're seeing is an illness, and then helping them deal with the grief about what it means in terms of the long-term life activities of a person who will have to integrate dealing with a chronic disease, just like you would if you had a chronic diabetes to integrate and to figure out how to operate within your system. So yes, that's true, but also integrated within all of these initiatives is the idea that families have communicated to us that they knew these symptoms were in place. You know, many times after the fact, after there's been a violent outbreak, if you talk with the family, they will talk about the fact that they recognized that their children were struggling, but they had difficulty finding a place for an intervention. The gaps in the mental health system are so extreme until they're so ill that they have to go into these very controlling environments because the escalation and the anxiety of the person is so high that they're acting out. So, other questions?
Schools, like early warning system or early treatment system? How would you describe it?
Would you ask that again?
I mean, how would the schools serve the purpose? What would the advantage of using the schools as a...
Well, the school is a place because of all of the various kinds of stresses that go on in the school, and because there's a consistency where you can see the emergence of these symptoms. So the school will be able to the school administration will establish a contract for the school linked program I'm talking about now with providers, and those providers will, depending on what that contractual relationship is, spend a certain amount of time in the schools consulting with counselors that are in the school, consulting with teachers, talking about best practices for how to deal with and diminish the stimuli in the environment that creates an escalation in the illness or in the psychosis, providing therapeutic intervention for the child who is there while they're in school so that the parents don't have to give up time to come and go, providing time for families, peer counseling, other group supports that would be available because we're able to integrate all those services in one place rather than be going home and then having to take the child to a peer support group and then having to take the child to a medication regime and then having another appointment to deal with something else. It's all there in the school, and it's up to the school to establish a contract with one of these providers who gets the grant to establish these relationships with schools.
Yes. Comment on that? Just a couple comments on your question. When I was principal at Rosemount High School, our counselors, I believe, are very good at identifying the red flags, the behaviors that we can identify that there is a problem there with that student that needs to be addressed. Cutting behaviors, grades going down, non-communicative types of behaviors. So they are good at, I think, identifying, and many times we used in our mental health people to sit in on those conferences initially with a parent to describe the behaviors, to describe a plan on how to address those issues. I'm glad to see in the bill we've got some processes to deal with many of the parents. I shouldn't say many, but too many times there were situations where their health insurance didn't cover or they didn't have adequate coverage. So I think perhaps something that in the future we can address as well and will be addressed. So thank you.
Another thing to remember is that half of all adults who have a serious mental illness began exhibiting symptoms by the age of 14. So if you wait until everyone's an adult, you've waited too long.
Do you know what percentage of schools currently have these services available?
17%.
And this would raise it
to about 37.
How is the success rate translated out of that 17%? I mean, do you have any way to measure that? How much work?
Oh, the outcomes? Oh, yes. Actually, under the grants, they're required actually to use what we call outcome measures. One is called the CASI tool, another is the Strength and Difficulties Questionnaire. And so they actually measure the child's functioning. And so we have data that shows that according to not just the therapist, but the teacher and the family, that the child's functioning has greatly improved.